As a team of therapists over the years, we have encountered an area of deficiency where, with adolescents, where a youth who is addicted to drugs or alcohol, you can place them in a residential treatment center or it's a rehab. The problem is that you're going to be paying anywhere from $6,000 to $10,000 a month. From an outpatient standpoint, we know that individual therapy or just family therapy is usually not enough to help disrupt these patterns. So we've had the great fortune of being able to begin an intensive outpatient treatment program for adolescents, which in most cases is paid for by insurance companies, which eliminates the financial burden for families. Part of that, when you're working with adolescents, the treatment has to be interactive. It has to be recreational, it has to be engaging. And so in our program, we spend a lot of time outside of the office in the treatment that we do. So we will frequently take our groups to hike and to boulder and to climb on the Red Rock. Those types of experiences provide opportunities for our groups to learn how to problem solve, to communicate with each other, to trust the staff, and to be able to experience sobriety and satisfaction through natural recreation. We will take our groups to our stables to do equine therapy, where they have the opportunity to build relationships with horses. And as part of that, they are given certain challenges and obstacles that they then work together with the horse to attempt to overcome. And in that process, they learn the importance of trust, and they learn the importance of relationship building, problem solving. And these experiences lead to them experiencing a satisfaction in relationships. We will have our groups go to Sand Hollow and to lakes to do paddleboarding, to experience new forms of recreation that they've never done in the past, and receive instruction where they realize that they can do new things and they can experience life in a sober manner without having to escape through drugs and alcohol. All of these experiences together lead them to a place where they can begin to have confidence that they can overcome their addictions, that they don't need that escape in their life, that there's satisfaction and value in the relationships that they have in their lives. For us, the part that really is the most satisfying is to work with parents who at one point were completely hopeless, that they felt like that they had no ability to reach their child. And at the end, to see them connected and to see the family healing is really what it's about, and that's why we do what we do. So we know with adolescents, in many cases, there is a limited window of opportunity to intervene, and it's early intervention. So if you see any warning signs in your teen, give us a call. Let's get your family enrolled in treatment now, and let's get the healing process started.